In same-day surgery coding, one of the most important topic every coder needs to know is about laceration repair coding. Other name for laceration repair coding is closure. In today's video, we will learn few key tips in order to code laceration repair, and also we will see few example scenarios. If you are visiting for the first time, please click on subscribe button, and also if you are looking for medical coding jobs in UAE, USA and India, please join in WhatsApp group. Our group link is in the description of this video. And also if anyone looking for same day surgery coding training, IPDRG training, SCC training, CCA certification training, please send WhatsApp message to 707-526-3939. So first tell me, what is a laceration, guys? So basically laceration means tear on the skin. So this laceration may include sometimes skin level, and sometimes it might go to subcutaneous as well as soft tissue level also. So now we will learn how to pick the right CPT for closure or repair code. First of all, whenever you want to code repairs, we need to check the location. So location of the repair, or where physician is performing the repair. In CPT, we have wounds are grouped anatomically. Like one section of codes includes face and ears, and another section of codes include trunk and extremities. So it is important that whenever you want to code laceration repair, you need to check the exact site first. Why means we have codes divided based on sites. Next, we need to code, or we need to check length of the repair. So whenever we code repair, we need to choose code based on the centimeters. So here our code selection will be strictly based on the total length of the repair. And here also one more important thing you need to remember is, based on CPT, our laceration repair codes are having centimeter in code description. So sometimes in operative reports, physician will mention this length is in the millimeters. So here you need to convert millimeter into centimeter. Why means our laceration repair codes in the CPT book are based on centimeters. So now here you need to understand how to convert millimeter to centimeter. So basically 10 millimeter is equal to 1 centimeter. For example, if the documentation is having 0.6 millimeter, means here you need to consider it as less than 1 centimeter. Why means 10 millimeter is equal to 1 centimeter. 0.6 mm is less than 1 centimeter. Next one is complexity. As all of us know, repairs are divided based on complexity of the repair. So we have simple repair, intermediate repair as well as complex repair based on the workup performed by the physician. So have you been coding laceration repair for few days? So do you know, can we add lengths together? Yes, we can add laceration repair lengths together. For that we have two criteria or two important points we need to consider. If the laceration repair is in the same anatomical grouping, we can add lengths of the laceration repairs combined. And also you can add laceration repairs if they are in the same complexity level. So most importantly, you can't add simple repair along with intermediate repair. For example, patient is having laceration on the face as well as ears. Okay. So physician is performing laceration repair on face and ears. So here you can combine face and ears. One means face and ears are in the same anatomical grouping. So here you can combine face and ear. For example, face laceration repair is 3 cm and ear laceration repair is 3 cm. So you can combine here. Total 6 cm. Why means these are in the same anatomical grouping. In another scenario, for example, patient is having 3 cm laceration on the face and 3 cm laceration on the trunk. Okay. So here you can't combine face and trunk. Why means face is one anatomical grouping as well as trunk is different anatomical grouping. So here based on the CPT guidelines, we can't combine the laceration repair codes if the site of laceration or site of repair is from different anatomical groupings. In one more scenario, for example, patient is having laceration on the face and patient wants to perform laceration repair intermediate. Okay. On the trunk also patient is having the laceration and patient wants to perform laceration repair on the trunk too or trunk also. So here face also intermediate repair, trunk also intermediate repair. Here we can't combine these two intermediate repairs. Why means these two are in the different anatomical area. And also, for example, if the patient performs simple repair on the face and intermediate repair on the trunk. So here you need to code two codes separately. Here you can't combine simple repair plus intermediate repair. So that is the CPT guideline. And one of the most confusing topic is, can we code if the patient uses the adhesives and strips for closing the laceration. So tissue adhesives usually we'll call it as glue. So if the patient uses only the tissue adhesive, so we need to use G0168 or we need to code based on the payer policy. For example, in one repair, patient has used the tissue adhesive as well as the repair code like simple or intermediate or complex laceration repair. So that time we can use only CPT code like simple, intermediate or complex repair code. So here we can't use G0168 along with this CPT repair codes. So then you might have the doubt. So how do we code if the patient uses only steri strips? So if the patient uses steri strips, we can't code any code. So basically steri strips is included in the E&M code. So we need to code steri strips application separately. So basically steri strips is not considered a repair, okay, unless combined with sutures or staples. So if the patient uses the steri strips as well as the sutures, we can code sutures. Next we need to understand what is included in the laceration repair code. So based on CPT guidelines, laceration repair global surgical package includes following terms. So we can't do unbundle. Okay. So local anesthesia is included using the lidocaine. Irrigation and cleaning of the laceration repair site is included, and closure is included using the suture, staples or glue, and wound exploration is included, simple debridement is included, and immediate post-operative care is included after performing the laceration repair. And one of the most important interview question is, how do we consider complex repair? So our complex repair codes are from 13100 to 13160. So these are the key terms. So if you want to code complex repair, in the documentation you need to check whether patient is performing extensive undermining or not. So what is undermining here? Releasing tissue to reduce tension between the closure site. Okay. Next, patient needs to perform scar revision. So then you can consider it as complex repair. So if the patient uses the retention sutures, you can consider complex repair. If the patient performs extensive or complicated debridement, you can consider complex repair. So these are the keywords for complex repair. In the documentation, if you see all these keywords, you can consider it as complex repair. So if the patient performs only deep layered closure, so you can't code it as complex repair, you need to code it as intermediate repair. So if you want to code complex, these are the keywords you need to check in the operative report. Okay. So multiple layered closure does not include complex. Most of the time multiple layered closure includes intermediate repair. Then when do you code E&M with repair? So you may be learning E&M code with the repair only if a significant separately identifiable evaluation is performed. For example, here patient is having head injury in addition to repairing a forehead laceration. Okay. If the patient's visit is only to assess and repair the wound, bill only the repair. So what are final thoughts here? So whenever you want to code laceration repair, you need to check the specific anatomic site. Next, you need to consider it as, or you need to check the length of laceration in centimeter, not in millimeters, or you can't base code based on the small or large. Okay. Next, you need to check the documentation, whether physician is telling layered closure, extensive cleaning, or debris removal. If you see all these keywords, for layered closure, you can consider it intermediate, extensive cleaning and debris removal, you can consider that as complex repair. Next, technique. How physician is performing the laceration repair, whether physician is using suture, staples or adhesives. So okay teams, thanks for watching this video. So as usual, if anyone looking for surgery training, IPDRG training, SCC training, CCS certification training, please send WhatsApp message to 707-526-3939. And also if you like this session, please click on like button.